Well, is this thing on? I bet this thing's on. Let's see if YouTube thinks this thing's on. As you can tell, I'm a highly experienced streamer. I actually haven't done one of these for decades. I think June maybe was the last time I actually did one of these. Things have happened with COVID since then, but it was just kind of felt to me like it was more of the same. Like I'd already said most of what I had to say, but as you can see, my readership has grown to an astounding 67 million.
Experienced
No,
streamer.
wait a minute, it's just 67.
I actually haven't done one of these for.
I've turned my sound on, so I'm actually playing myself here. All right, I'm going to calm down here, close this window. Tell me in the chat if you can hear me. I think this is working. Yes, it seems like, other than not liking my resolution, YouTube is very happy. So let's talk. Let's talk about COVID. Let's talk about COVID numbers. I'm Greg Farrar. This is funded in part by my employer, Joby Aviation. Cool company, by the way. Electric flying taxis. We'll all be flying in them someday, I bet. But for random reasons, well, not so random. Really, Joby just wants to be able to work like everyone else, all of us. And so Joby has been involved in analyzing COVID data as well as a side project and in testing and so on. And so they decided to let me do this as part of my job. Woo! So yes, 67 even subscribers. All of you have asked me to do another one of these, though. And I'm guessing it has something to do with Omicron. So let's talk about Omicron and everything else. I'll do it in my usual format, which is to say, oops, I'm on the wrong tab. I'm going to start with the countries of the world, followed by the states of the United States, followed by the counties of California, where I spend about half my time. I'll be really just paging through my own website, gregfarrar.us. You can go there anytime you like. It's just this. It's all I've got here is my COVID analysis. My graphs and so on, and a little bit of textual analysis, some older blogs. I haven't blogged for a million years, and maybe a Medium article or something. But anytime you want to go back and do this kind of analysis yourself, the data's there, the graphs are there, they're interactive, you can do this same stuff. So I'm really just going to be taking a particular path through a whole mound of data, especially focusing on the locations that I know that my many viewers are interested in, which is to say basically where my sisters live. So let's go. We'll start with the countries, but I'm not going to spend as much time on countries this time. I think that what people are really interested in, who've been knocking on my door for a reprise, are the states, because things are going nuts. And it's holiday time, and so everybody's wondering whether they're going to kill grandma if they go to Alabama. And so we'll see. Well, I can't promise either way about grandma, but I can give you some numbers that will help you make that kind of decision. And I can, in fact, talk about that very decision, similar decision, that I had to make myself recently about whether to go tomorrow to Georgia to see my mother and many sisters. Several sisters, a couple of sisters. So I'll start here. I'm going to skip over severity, my own special metric. I don't know that I love severity so much anymore. It's a metric that combines the total number of daily cases per million along with the growth rate of cases. Severity is cool in that it gives you kind of a quick sense of how bad things are, but I don't know. I find myself always heading back to the daily cases per million and the growth rates. So we'll see. Maybe we'll come back to it. Some of my graphs are broken, as always. I'll just skip over those ones. I've added a few new ones since last time. Let's just look at the worst countries of the world, first of all. This is since the whole thing began. So you can see this trend here since the whole thing began. Back in early 2020, there was no COVID, and then we thought what we thought was a terrible wave in April. COVID killed a bunch of people, got a bunch of people sick, and now it looks like peanuts compared to what we had, for instance, at the beginning of this year in January. And now look at this. We actually, as a world, are even worse off than we have been, at least as far as daily cases per million works. This is getting the number of cases of COVID, and I'm going to talk quite a bit today, I think, about my new, somewhat speculative interpretation of what Omicron means, but I'll give you a quick preview that cases may not quite be the metric anymore. They may not be the most important metric anymore in terms of the effect on human suffering, human life, the healthcare system, and the things that we care about. Nevertheless, cases is what I've always been talking about, and so that's probably what I'm mostly going to talk about. And I'll get into a little later why cases may not be the thing anymore to be focusing on. But if cases are the thing and are an indicator of what we care about, things are very bad right now. These are the 20 worst countries. You can see something astounding happened in Slovakia. Those who followed me all along will know that I consider 100 daily cases per million or higher to be a hot spot or to be a warm spot. 200 daily cases per million is a hot spot. And 2,000 is terrible. It's ridiculous. It's basically off the scale. We had to this graph had to extend itself to acknowledge the existence of such a number as 2,000 daily cases per million. So Slovakia was miserably bad in early December, 2,000 daily cases per million. And again, daily cases per million adjusted for population means that we can compare these countries. This is one of the things that I did early on that before all the cool kids were doing it, which was to say adjust by population so that we can actually do a comparison and say, well, okay, if Belgium has 1,500 daily cases per million and Slovakia has 2,000, we don't need to think about the population of those countries. We can just say this is a third as bad or a quarter as bad or something. It's a quarter worse. This is worse than that. Whereas when you just look at the total cases, which is what we often have in these graphs, a country that has 10 times more cases than another country might be better off if it happens to be a much bigger country. If it's 100 times more population, then 10 times more cases is good. Better than, it means it's 10 times better. Anyway, as we can see, all of these countries, these 100 worst countries, are above 500 daily cases per million. That's a really bad number in cases. You can see historically, we often have seen numbers above 500, even from these exact 20 countries. But in a good period, we see numbers more in the range of 100 to 200. Of course, in a really good period, we'll see it drop to zero or almost zero. We saw it before COVID, there were none. But it becomes more and more clear to me that we are never going to see COVID drop to zero. COVID is not going to be the next smallpox that we just make the vaccine and everyone takes it, and then no human reservoir being the only way of transmitting it, no animal reservoir. We never see it again. COVID probably does have an animal reservoir, even if we haven't figured out which particular bats that might be. If not, it probably can be held off in some, we know that cats and certain other animals can get it. So even if we could somehow clear it from all humans, it would come back. So COVID is going to become can't find the word. Endemic? Is that the word I'm looking for? Not epidemic. It's going to become a disease that lasts, and it becomes like the flu, and we just learn to live with it. But right now, we certainly don't have to live with it at 1,000 daily cases per million, which is what we've got. And so right now, things are pretty bad. On the bright side, I guess, if you look at Slovakia, just because it's the worst right now, you can see that it was at 2,000, but now it's at 1,000, and the cases are rapidly dropping, which is interesting, especially given the news about Omicron. Omicron is not currently driving the numbers up in Slovakia. And it wasn't driving the numbers up to here in Slovakia either, because there was no Omicron, at least not that we really knew about a month ago. So, sad news. After a long time, the United States has made it back into the top 20. For the longest time, the United States has not been heavily hit. And by the way, there's some categorization by region as well in this data set I'm using, which I've just left in, which sometimes leads to some strange results where we'll have something like European Union right next to a country, or you'll sometimes even see something like Asia in these lists. It's still convenient because we still adjust by population appropriately. And so, the European Union is pretty bad. As you can see, almost everything here is Europe. The UK, Denmark, Switzerland, Ireland, you got to get pretty far down this list. Georgia, that being the republic, that being former Soviet Union, Asia, Georgia, is about almost the only thing I see really here that isn't Europe. So Europe is just miserably bad now, but the United States is trying to step in and win this one by shooting upwards. I keep hearing the term almost vertical to describe the graphs of certain states in the United States, or cities like the New York City or Chicago. Or they're terrible. These graphs, it's like you can't get much steeper than they get. This is a little bit more moderate because it is being balanced out against all the states that don't really have it so bad. Mostly, as we'll see in the United States, it's a Northeast and a sort of central Midwest phenomenon right now. So Florida, for instance, which had such a terrible wave, is not terribly hit right now, or maybe it is. We'll see in the next section. But the worst of it's in the Northeast. And so the whole United States as a whole, averages this, and we get a mix of. It's still quite bad. Again, 200 hotspot. So we're up above 400 in the United States, and that's sort of, in the past I would have said that's, lock up your children levels, or at least lock up your grandma, because certainly COVID is more damaging to the elderly. I think I'm trying to decide when to bring in this, my current thoughts on Omicron. I guess I'll start now, just to say that I had to make a decision a few days ago about whether to go to Atlanta. I was in California, I'm now in Colorado, and my family's meeting in Atlanta, and sort of a standard for our family Christmas or holidays. And these numbers were rising and rising and rising, and my mother's older, and really all of us are older. Many of us are older. All of my siblings are getting into the range where we're particularly susceptible to COVID. So should we cancel? We've certainly done it before. I forget what we've canceled. I think we canceled last year, for instance. I don't even remember. But we are willing to cancel when things get bad and lock ourselves in our rooms and mask up and vaccinate and do all the things. And try not to have any interaction with people. But was I willing to go to this family gathering tomorrow, knowing that COVID cases are rising, and knowing that for especially my mom coming from Ohio's been a real hot spot. And so my mom could be bringing doom to the family from Ohio, even though in Colorado it's not so bad, and in California it's really not that bad, and various other places we're coming from, not so bad. Nevertheless, in Georgia, by the way, where we're going, not so bad. I seem to be getting way ahead of myself listing all the states. We'll see them later. But do I go to Atlanta? And here's the calculation that I did. Last year, under similar circumstances, no way would I have gone to Atlanta last year. But this year, we have a number of factors that change kind of the bottom line. So Omicron is highly infectious. The cases are growing quickly. That's bad. However, very early data and somewhat conflicting data, but nevertheless, as of the latest, the largest, most high quality studies we have from South Africa, from Scotland, from other places, I think there's another one from the UK, the latest data we have suggests that Omicron really does result in fewer hospitalizations and deaths than Delta or Alpha or all the other ones. Omicron is less dangerous. So if you get it, you're less likely to die from it, less likely to be hospitalized. So that's one of the factors there. Also, Omicron, since it's rapidly taking over the world, already above 70% in the representation in the United States, 70%, 80%, probably 90% by now, frankly, cases are Omicron. And they're pretty much all going to be Omicron going forward. Omicron has outcompeted and forced out of the arena all the other variants, and that because it's so contagious. And if Omicron really is safer, less dangerous, less likely to cause hospitalization and death, then that's a good thing. Because that means that if I go to Atlanta, or any of us in Atlanta, if we get COVID, we're very likely to get Omicron. And the outcome is likely to be better than if we had gone last year, when we would have gotten Beta or whatever was the coolest new strain then. So more cases, bad. less severity, good. From the healthcare system's perspective, this is probably not even a wash. It's probably overall a bad thing, because there are going to be so many more cases now that even with a 2/3 reduction of hospitalization, there probably will be more people in the hospital. So there's still the danger of overloading our healthcare system, and we'll see in the coming weeks whether that does happen. But at least it's a tug of war here between the Omicron variant causing clearly more cases, especially among the unvaccinated, and then the reduced severity of the strain causing those cases to be more likely to recover at home. So speaking of unvaccinated, then the other second line, I think of this as like 4 lines deep. It's like a long multiplication here. The calculation of how dangerous it is to go to Atlanta, which is the same calculation you can make in any decision you're making about COVID. Vaccination. Omicron is somewhat able to bust through natural defenses from previous infection. It's somewhat able to bust through 1 or 2 of the shots. If you've been vaccinated, it's obviously easily able to infect you if you haven't been vaccinated. So if you haven't been vaccinated, all I can say is you should be. As I've always said, it's very safe, and it's much, much, much more dangerous now. Especially with Omicron. Suddenly it's become even worse to be unvaccinated, because everyone's going to get this thing. Everyone is going to get COVID in the next probably months. Everyone who doesn't literally go around in a spacesuit is going to get COVID, and it's just a question of what happens from there. But most people have been vaccinated. So putting the unvaccinated aside, and my whole family's been vaccinated. So for this calculation of Atlanta, since we're all vaccinated, that's another factor of safety that we, and it's in particular, if you've been vaccinated with your second shot recently, or if you've been boosted recently, especially booster shots seem to help with COVID, with the Omicron strain. It still can break through and does break through, and even all the vaccinated people, I think, are eventually going to get Omicron, most of them. But when it breaks through, it does not do as much damage, and so if you're vaccinated and you have Omicron, you've got a couple things going for you. You've got a 2/3 reduction in severity because it's Omicron, and you've got maybe 10-fold, 12-fold reduction in severity because you're vaccinated and boosted. That's starting to seem like a whole lot better than the baseline. But it gets even better, because just earlier this week, 2 drugs were approved. I don't have them on the top tip of my tongue, but I think one of them is the Pfizer anti-COVID drugs, COVID treatment drugs, which, at least in the case of the better one, which I think is Pfizer, they give you something like another 10-fold increase in the reduction of severity. And so if I do go to Atlanta, let's just keep it in first person for a minute. I go to Atlanta, I'm vaccinated, I'm boosted, I'll be masked, I'll try to be outdoors, I'll do all the things. Nevertheless, there's certainly a better chance of me getting COVID than last year if I'd gone, because Omicron is so prevalent and very contagious. So if I do get COVID in Atlanta, then I'm vaccinated and boosted, so it'll likely be a mild case. And if I test positive for it and immediately start taking the drug, the chances are I'll just end up quarantined in the hotel for 10 days or 7 days or whatever the new guidance is, without ever having to go to the hospital. So there goes a ton of load off, because these are take-it-home pills. You go to the doctor, you go to the emergency room, urgent care, whatever, you get your pill, you go home, you take your pill 3 in the morning and 3 in the evening, and for 7 days or 10 days or something, and in all likelihood, you never have a severe enough case to have to go to the hospital. So not a good outcome, getting COVID and quarantining for 10 days and having to take pills and go to the doctor. But it doesn't hit the healthcare system, which is really important, because we need that healthcare system for all the people who, the unvaccinated especially, but also the vaccinated breakthroughs who do need care. We need the healthcare system as healthy as it can be and as underloaded as it can be. And so if I get COVID, I can get the drug, and probably vaccine plus drug makes it I'd say highly unlikely. I multiplied these all out in my case and came with a number of 0.2%, which is to say I'm something like 0.2% as likely to end up in the hospital now as it would have been if I'd gotten Delta when I was unvaccinated and there were no drugs. And so that's a 500 times improvement of outcomes. So what does this all mean? Well, what it means is I'm going to Atlanta, assuming my planes don't get canceled, because in addition to the healthcare population, we're also losing all the flight crews. So we'll see. So far, I have my flight, but a lot of flights have been canceled, and we're going to see a lot of things slow down, at least, due to Omicron, as people get cases and get quarantined, but probably don't end up in the hospital. The vast majority of them, 500 times fewer, if everyone's vaccinated and boosted, end up in the hospital now. And so we see the whole country shut down, but maybe just for a couple of weeks. But it starts now. So yes, I'm going to Atlanta. And generally, I think we may have come to an inflection point. A lot of this depends on, there's one key piece that is still unproven, which is Omicron actually safer? Omicron, there's been some evidence it may be more dangerous, especially for very young children. There's been more evidence, I think, and from more high-quality studies, that it is safer and less harmful, lower chance of hospitalization, as I've been saying. But if Omicron really is more dangerous, which no one would be astounded if that turned out to be the thing. That's science. We get the new studies. Eventually, the weight of scientific evidence falls one side or another. So if it turns out that we just had sort of a swing to the wrong direction here in our scientific understanding, and we come to learn through the additional studies that are all being madly done now, that Omicron is actually the same, most likely, or even more dangerous, then that certainly, it changes the calculation. But we still have the drugs. Studies say those help a lot, and we still have the vaccines and the boosts. So, what I'm hoping is Omicron really is safer, and that it forces all the other variants out, which it already has. If that turns out to be the case, I think we're actually in a good place here, where we're going to go through some just weeks of pain, and then maybe, just maybe, we're going to find that we can kind of return to normal, because it's torn through the whole population, and most people didn't die, and most people didn't go to the hospital, and now people are extra immune because they had it. Anyway, long monologue. That is my current thinking on Omicron. Right now, of course, as always, my recommendation is get vaccinated, get boosted, wear a mask, social distance, don't go indoors with groups if you can avoid it, open a window if you can't. Just generally stay away from people. We're still in a very tricky place, and the healthcare system cannot handle people being fools. All right. That's a lot. I'm already most of the way through the time that I would have allocated to countries, so I think I'm just going to roar on. Maybe I'll just take roar on to the states, take one moment to take a look at the growth rate in the United States. Here it is already. I was already looking at it earlier today, it looks like. So we had a period where the growth rate, week over week growth rate of cases was 60% or 40%. And then we had some time when it was below zero here, which meant the cases were shrinking. We're growing again. It's not an astonishingly high growth, which actually kind of surprises me, given what we've been seeing with near vertical graphs of the cases. You would think the growth rate must be very high. But so far, maybe just because it's only in the past few days that we've really taken off, like the past 3 days, and these are 7-day averages or 14-day averages of 7-day averages. It just may not have started to show up here yet. But even before Omicron really took off, we were starting to see what's obviously positive growth. Anything above zero is bad. It means the cases are growing. This is the United States, and right now we're growing at 10%, which is obviously bad. We want to be shrinking, but we've seen worse. I don't usually really freak out until things get to 20%. There was a period we were at 20%, but that was a couple weeks ago, and for some reason it seems to have gotten better. So let's dive into the states of the United States. And again, you can drop a line in chat if you'd care to ask about your own favorite state Wisconsin or whatever it may be, and I can focus on that because I really, as you can see, we don't have a huge number of concurrent viewers right now. Those who do watch this stream tend to watch it late at night in the privacy of their own beds, I think. But you have a chance here to ask for a focus, and I will try to notice it in the chat. I'm going to skip over the severity again and just talk about daily cases per million. And first, just take I'm going to go down to this graph. This shows all the states over the entire time, not quite the entire time, but back quite a ways into April of 2020. These are the cases per state. And of course, this is a terrible mess, and you can't see anything much just looking at it. The idea here is you come to the website, gregfarrar.us, you click on your favorite, Hawaii, and you say, oh no, look at that, isn't that terrible? And Hawaii is indeed terrible right now, as high as it's ever been. I think it literally has just reached, its average has just reached higher than it's ever been. And we're seeing this a lot across the United States. A lot of places have reached new highs just in the past couple of days, and that's Omicron, and that's going to happen even more. I think we're going to see just an immense wave of COVID cases. But again, for all the reasons I just described, that may not result in terrible outcomes in any other way. We might just be able to say, yes, there's a huge, terrible spike in Hawaii COVID cases, but what do we actually care about? We care when people die. We care when there are hospitalizations and the system gets overloaded. We care when businesses shut down, and we care when our lives are affected. If it turns out that because of all the factors I've been talking about, that Omicron is basically just the flu now, then we're gonna miss work for it, and that's about all that's going to happen. We'll quarantine like we do if we have the flu, because we don't want to give it to other people, and we want to flatten this curve as much as we can, which is not much, I think, but we want to keep transmission rates as low as we can, and that means if you have COVID, you quarantine. But it could be that that's actually going to be about the worst of what we see. That it'll be like the flu, sure, killing thousands of people as the flu does, but not something that we as a society decide to radically change our lives over, or which is another way of saying that is we may decide to unchange our lives to go back to full-on normal if Omicron and all these things work out in the way they just might. So, as I've said many times, I have an optimism bias, which means that my predictions are more likely to be optimistic than the future is likely to be worse than I predict, because I always see things in the shiniest, brightest possible way. And so I saw a Medium article the other day which actually kind of inspired me to do this live stream, which was just this pessimistic portrait of doom. The Omicron is, look at these graphs, they're nearly vertical, we're all going to die. Not all of us, but 2% of us are going to die, and there's nothing we can do about it. And I do want to push back against that. I think that person has a pessimism bias to imagine that there's going to be terrible destruction due to Omicron. There are reasonable arguments, the ones I've been making, to say that there will not be terrible destruction due to Omicron, thanks to all of the technological work we've done on drugs and on vaccines and on learning what actually works to slow transmission. So anyway, we look at something like this in Hawaii and you say, I'm not going to vacation there. Well, okay, certainly the safest thing to do is to stay at home and not interact with anyone. And I made my decision. I'm going to go lightly interact in a masked way with a small group of people over this weekend and the coming week. And if they were in Hawaii, I probably would do the same. So, let's look at California and Colorado. So Hawaii, not normally one of my focal points. Colorado and California. I split my time between them. A lot of people I know and the people who watch this are in California and Colorado. Now, notice that these are relatively good. They're compared to some of the things we've been seeing. Let's just bring in Rhode Island for fun. There, wasn't that fun? Here's Rhode Island. We're at 1,300 daily cases per million, which again is just kind of off the scale. We don't see 3 digits. 1,300 is not very often. 1,300 is really bad. Rhode Island has a habit of getting ridiculously high. You can see it did it once before, in spite of being the headquarters of CVS, I think. So you'd think they'd get great tests, but there's Rhode Island. This is an example of a bad epidemic or regional epidemic. Rhode Island is super, super steep, rising, no end in sight. Who knows how high it goes? That's Rhode Island. I don't think I would go to Rhode Island this weekend. That graph might just be enough to change my mind. But now there's Colorado and California, my 2 states of residence. Colorado, it's at 400. It's bad. I mean, 200 is a hot spot, so this is bad, but it's better than it was, and it's not clearly trending upwards. There's a little bit of tick there, but I won't take that to mean much yet, though in the context of seeing that every other state is rapidly shooting up in the past few days, you start to think there may be a little more to believe in that angle on Colorado. But still, 400 puts it in a pretty severe place, but better than many. California, in the meantime, had gotten so good. You were doing so well, California. I mean, especially back here. I really like to see numbers in around 10 or 20. California briefly, or for a while, for a sustained while, was really down in the good place before it got that wave that everyone got. And then it seemed like it recovered. It didn't get hit bad by Thanksgiving, as other places seem to. It got down below 100, so it wasn't even a warm spot in my nomenclature. And now it's kind of losing its grip. Back up to 285, rising rapidly in the very short term, but still, since December 16th, that's a week, it's gone up. This is such a long-term graph. Maybe we should zoom in a little bit so we can get a sense of like how long have we really seen these rises? Since December 17th, so what is that, a week? We have a sustained week rise, fairly sustained week rise here, and more than a week rise there. These start to be real. A couple of data points doesn't mean much, but when you see enough in a row, that starts to look like it's indicating some sort of a trend. Too early to say for sure with California or Colorado, but looking bad. Ohio, by the way, whoops, I didn't mean to do that. I'll bring in Colorado, see if I can get us out of here. Yeah, so Ohio. Oh, poor Ohio. Poor mom in Ohio. This is just about as bad as it gets. Ohio hasn't quite caught to Rhode Island, but it's just really steeply rising. There's nothing happy about what's happening in Ohio. The only saving grace of any of this, which I probably keep saying, is all the things I talked about earlier, which is to say having a huge number of cases now may not be comparable to having a huge number of cases a year ago, because a year ago, vaccines, we didn't even have them, right? Vaccines weren't there. Or maybe just barely then. We didn't have the drugs. We didn't know as much about testing and about masks and the effectiveness thereof. We kind of knew that. We just have become even more sure in the months since, and so. And we didn't have Omicron, which again, I'm speculating here, but not a huge amount, that Omicron is less dangerous, and having squeezed out the other variants, this is probably way better than that in terms of deaths. I have, in fact, and maybe I'll hop down here right now, added a new graph, which is kind of, I think I used to have this graph back when I used the COVID tracking data set. I eventually ditched that and moved to the New York Times data set, which they did have deaths. I don't know why I got rid of my deaths graph. Partly it's just because deaths always seem to just be the same as cases. They just follow cases a couple weeks later. But I'm going to be watching these much more closely in the coming days. California, Colorado deaths, and let's just throw in Ohio deaths. We'll ignore that little blip there. I'll zoom in so we don't see it, some sort of data problem back in the history. But over 10 deaths per million per day, I'm roughly going to say is kind of a cutoff where I start to think it's really a deaths hotspot in deaths. we're not there now. And like, if we go into the history, we can see we have been there. Like Colorado was up to 16 at a time. California was up to 14 at a time in the past during that really bad last December-ish, January-ish wave. Actually, this is the January wave and it is December and January. The deaths are not as bad yet. So we're just going to have to keep watching this to know what that means. I suspect strongly that we're going to see the deaths kind of linger about at this level. And we're going to see that because of all the things I've been talking about. Even though the cases are going to go through the stratosphere, all those other 500-fold pulling down factors that weren't present here are going to make it so that not as many people die now as used to. Not as many people are hospitalized. That's a prediction, not very well supported by data at this point, but I do love a good unfounded speculation, and so that's a lightly founded speculation about where the deaths are going to go. But more to the point, I'm going to be watching these more just as the actual indicator of how bad things are, because we can kind of throw away all those other factors and say we don't care in some sense how severe Omicron is. We don't care in some sense whether vaccines are effective or whether masking is effective or whether shutdowns are effective and whether we don't care about any of these things. What we really do care about is how many people die. At least that's I would say pretty close to the top of my list of what I care about. How many people are dying? How many people are hospitalized? Maybe long COVID fits in there as well, hospitalizations and long-term disability due to COVID. But this deaths graph may be as close as I know to get to showing the most important to me impact. And so we can speculate on all the multiplication factors of what percentage does it help if we wear an N95 instead of a surgical or a surgical instead of a cloth. We can speculate on all these things, but in the end, these deaths this is where the rubber meets the road. And so far, what we can say is deaths have risen quite a lot. They used to be under 1, and now they're rising into a pretty high zone, really, of 7 or so. Not in California. California's, the deaths are still quite good, down at around 1. We're not seeing, that's 1 in a million dying every day. That is not an extraordinarily large number. Still, every death's a tragedy. But from a population perspective, data analysis perspective, this is a good line to see. Will this rise above 10 as it has? You be the judge. The future will show us. I'm going to go out on a limb and say it won't. That all the things we've done to mitigate deaths are effective. And then Omicron came by and is going to help us tremendously, at least starting a month from now probably, by squeezing out all the most dangerous variants. And then, of course, there's the counter factor that a whole bunch more people are going to have it, and therefore, even with a much lower percentage of death, we could still have more deaths, just because it's a higher numerator. I think it's the numerator. I'm not going to think too deeply about the math of it. Anyway, so this graph, I like this graph now as maybe something I'll probably come back to. I might do another one of these in just a few weeks to answer that question. Did the deaths go up dramatically because of Omicron? So far they haven't, but Omicron hasn't been around long enough. It takes people couple weeks to die in the hospital. And so now that we've suddenly got a tremendous boost of cases due to Omicron, it's going to take us a couple weeks to see whether those cases terminate terminally with someone dying in a hospital, or whether, as I kind of expect, they take more of the typical flu course with the help of meds and hopefully of a lot of people who've been vaccinated, that they recover with maybe no symptoms at all, or symptoms mild enough they don't require hospitalizations and certainly don't die. Okay, let's go back to wherever I was. Here, I guess I was. Ohio has got a large number of cases. For my Louisiana fan, you know who you are. Louisiana, which has had some really bad waves in the past, is it's doing the thing. Everyone's doing the thing. We're all dancing in lockstep towards 1,000 thanks to Omicron. For the past 5 days or 7 days or so, Louisiana is suddenly spiking higher. But right now, it's not there yet. It's only at 300. It's funny to say only 300 because 200 is a hot spot. But we've seen such crazy numbers recently that 300 almost starts to seem not so bad. And again, for the 10th time, maybe 300 isn't bad because of the factor, 500-fold factor, where the final result of death is so greatly reduced that a rise of cases is not as serious as it used to be. Ohio, yes. Let's look at Texas for my fans in Texas. Looks a lot like Louisiana right now. Rising, of course, but still, but not super high. My sister moved, and I don't know where she moved to. I'm like, was it Tennessee or was it Kentucky? I'm going to say Tennessee. Tennessee and Kentucky. Who can tell them apart anyway? Nashville? I'm sure someone will tell me where my sister lives now. But Tennessee, if that's where she lives, similarly, rising sharply. Not yet in a really astonishing range. Let's just zoom out. Have I picked up all the ones that I normally care about? Sometimes I care about Illinois. Let's look at Illinois just to notice where there are big cities. This is growing at a very alarming rate. New York, I'm going to just pull up just New York here. New York looking like the Northeast. Not the kind of graph we like to see. The only thing we can hope is that I'm right about the factor of 500, and that even though we have a ridiculous number of cases, we're not going to have a complete annihilation of the population of New York. So I'm going to pull up all the states for a minute here, just to, and very briefly, just I don't know. That's the Northern Mariana Islands. The small territories always had outsized swings, very small population. Or the District of Columbia, speaking of small territories. 2,000. Yeah, that's a lot. That's a lot. Washington, D.C. The picture of all of them, all of the states combined, you can see on the smaller scale, it doesn't quite look like they're heading for the vertical, but this is just a couple weeks. We can definitely see, unquestionably, in the past few weeks, that there's just a lot of upward trend here, and there's acceleration. All the states are heading upwards and not all of them. I mean, you look at something like Montana. Montana's fine; it's not showing a burst at all. Maybe it just hasn't gotten there. And generally, if you look at the map, for instance, the New York Times has a good map of the states. I don't actually show a map view here, but if you look at a map, it's very clear where Omicron is strong right now. Northeast, and then in a line heading southwest from there, from the north, from New England states down to maybe Indiana or Kansas or something. I don't know whether Kansas is really affected, but not so much in the west, not so much in the southeast, not so much in the north middle. So we have states like, well, Guam, I guess, but Montana also, Wyoming, they're kind of fine. I just drove through Wyoming, got stuck in Wyoming in a blizzard for 4 days a week or two ago, and nobody was wearing masks in Wyoming. And maybe that's okay. You look at this graph, okay, it's 186. I normally would have said that's kind of bad. It's almost a hot spot, but you compare it to the rest of the states, it's certainly safer to go unmasked in Wyoming than it is in the District of Columbia. Look at that. 2,000. So don't go to DC if you can avoid it right now. But again, with the R factor of Omicron, the explosive infectiousness of it, I think we're all going to probably end up looking a little bit like the District of Columbia in the next few weeks. I think it's kind of going to get us all. I don't know that if everyone's going to get COVID, but every region is going to get a whole lot of Omicron cases and a sharp rise. And it may really be that everyone's going to get COVID unless you live in a hamster ball, hermetically sealed, and go through about your daily business entirely that way. And I mean, that's always a choice. Some people do live that way, but I for one, I'll wait a few weeks, see if Omicron is really killing everyone, and if not, I'm not going to throw a COVID party, but I may try to cautiously get a breakthrough infection one of these days, just so I don't have to worry about that anymore. We'll see. It may become clear that this is that the restrictions and the protections we've been using may no longer be effective or, fortunately, necessary. But let's give me a month. Please don't go out and do anything different right now. My advice is still get vaccinated, get the booster. If they do a fourth booster shot, get that too. Wear your masks, wear an N95 if you can, wear a surgical if you can't wear an N95, and if you must, wear a cloth. I know they're pretty, but they don't work as well. And I know they're also eco, so make your decisions on what your priorities are. But if you're looking for maximum protection from the virus, N95. That may be all I really need to say about the states. I will take a moment maybe to look. I don't know what to make of this growth rate. Actually, yes, I do. I thought I wasn't seeing anything interesting here. I'll just, for a moment before I zoom in, I'll say, look at the history. And by the way, look at Northern Mariana Islands, always wildly fluctuating. So let's just take them out of the picture for the moment. These are the current hottest in cases, and how these particular 19 states have fluctuated. We can see a lot of, and this is the growth rate, how much week over week the cases grow. So 100 means the cases are doubling every week. 0 means nothing's changing. negative 50 means we're dropping by half every week. So they fluctuate. They always roughly stay around 0. They never go to 1 million or anything, but you can see differences like a really good recovery here for all these states where almost all of them were negative in growth rate, and a really bad spike for all these states in the middle of the summer where they were heavily positive in their growth rates in 50 to 100% range. But if we look I'm going to look at all states here. I'm going to get out of the just the top ones and look at all states for a minute and just zoom in. That's not enough. Yes, it is. Zoom in. Let's see how much I'm zooming in on if I do that. No, I didn't want to do that. I want to do this. Come on, work with me, graph. I'll zoom in a little bit farther so that lets me do it. But I wanted a closer view. I guess I can do it in 2 stages. So we had this is the hump I like to call Thanksgiving. We had a sudden growth burst right after Thanksgiving. I don't think that was a coincidence. We can expect one after the holidays that are happening now. Independent of Omicron, there will be an additional multiplicative factor because some people, like me, are simply not willing to lock ourselves up in our basement for the holidays, but are going to go take our chances in with some friends and family. So that was kind of terrible. But then it got over it again, mostly, and a lot of these are all 50 states plus territories, and they headed back to 0 for a little bit. But yowza, look what's happened since. District of Columbia is growing. Have I ever seen a 300%? 300% weekly growth rate. Hawaii, as we saw, 300%. I generally think of 20% as really problematic. It's a very problematic growth rate if you're at 20% or higher. Look at these numbers. Florida, which, and this is why I like having this graph separate from total cases. I'm going to pop back to the other graph for just a minute. We didn't talk about Florida. Why didn't we talk about Florida, or we didn't talk much about Florida? Because Florida has been kind of okay. Wow, Florida is not at all okay. Okay, I think I just haven't looked at Florida for a while. Florida really is doing the thing. But there was a period after Florida was one of the worst where it was fine, even into December. And now Florida has suddenly shot up. So never mind, Florida is not as bad as Rhode Island, for instance, or New York, which is at twice. But Florida is really very bad again now. So never mind about Florida not being fine, or being fine. Florida has joined the pack. And you can kind of see this. I kind of get these sense of the rope is unraveling. One at a time, threads are being pulled into the 100% range, or in outrageous cases into the 300% range. Or I don't even know what Puerto Rico is doing. It's off the scale, literally. But it is possible that most of these threads, though they're currently sometimes in many cases, like here's Montana shrinking in cases, or Alaska shrinking in cases, or even Oklahoma, which is really shrinking in cases, this doesn't look like an unusual rope compared to the ones we've seen. You look back in history, it tends to look like that. They tend to cluster around a kind of center, which is zero, and sometimes the whole country is doing a little better, and sometimes it's doing a little worse, but they tend to group together. Right now, we're seeing a explosive fraying of our rope, where several threads have gone off the deep end into this uncharted 200-300% range. And this has just got Omicron written on it, I think. Though it's a little surprising. No, that's right. This is a fairly short time scale. I was thinking this was going to go back into November or something where we didn't at least know about Omicron. But these I think are simply Omicron taking the world by storm, one state at a time. Florida has caught it. The Virgin Islands, yes. Louisiana maybe is starting to fray, and we may see maybe I'll do another one in just a few days, because now I'm getting very curious to see where this graph is headed. In a few days, are we going to see all of these things catapulting into the 150-250% growth range? Maybe we are. Or will we maybe see just a few of them do this, where the remainder hang around zero? Also possible. My guess is we're going to see, one at a time, the whole country falling like dominoes under the irresistible force of Omicron. And here again, the only saving grace is that we have a lot of mitigating factors that might mean that a huge wave of Omicron won't mean a huge wave of suffering, or at least not of hospitalization and death. So yeah, that's where we stand with states. I'll hop quickly to the counties, but we got a train coming here, folks. There's a train coming, and we're on the tracks, and don't think we get off it either. So we're all going to get hit by this thing. There are going to be a lot of cases, and I hope that I'm right, that in spite of that, we're going to be okay. I mean, we're going to be okay, though. This isn't going to be the Black Death. We're not going to see 70% of our population die, at least not from the Omicron variant, because it kills at the same rate that the other ones do, which is maybe 1%. So, worst case, 1% of the United States dies. That would be really, 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 really terrible. And there are easily conceivable much worse cases than that. COVID has always been a mild illness compared to some of our historical pandemics, the Black Death being the really atrocious one, but also the 1916 flu pandemic, or I don't know, even the predecessors of COVID, the SARS-V1 was really destructive, and we're just lucky it never took off the way that COVID did. Maybe because, as we see, the most virulent diseases kill their hosts so quickly they don't get to spread. And this is why we tend to see pandemics made from less dangerous diseases, and that we tend to see that they become less dangerous as time goes by, which I hope is what we're seeing with Omicron. So I have hope. I don't know. I'm going to take my chances in Atlanta. I know that a lot of people drop off at this point, but for the California listeners, I'm going to move on now to California counties. So, don't have much time here, about 5 minutes. Let's take a look at the California counties. Well, first of all, actually, I'm going to hop back to California just for a minute again so we can see what is California looking like in growth rates. Kind of bad. As I said, 20% is bad. I like the word bad. 27% is extra bad. It's not as severe as some. So California, it might be one of those threads that's starting to pull away from the rope. in daily cases per million. We'll probably see it here as well. Yeah, as we saw earlier, there's a very unpleasant direction to our graph in California, where after a fairly mild period, moderate period, I'd like to see it much, much lower than even this, but after this period, we've now busted through the 200 mark into hotspot territory, and we're heading upwards at an accelerating and really quite dangerous pace. So that's the state as a whole. Well, so who's responsible? Whose fault is this, county-wise, that we're doing all this? I actually don't know the answer because I have not been paying attention to counties, but let's find out together. Here we have, well, let's see. Imperial. Of course it's Imperial. It's always Imperial. Imperial has a prison. Prisons are terrible for COVID. So yeah, Imperial always gets the worst of it. Here's Imperial at 600 daily cases per million. Now, again, the value of doing the population adjusted numbers is we can compare Imperial, for instance, to New York as a state. We can compare the county of Imperial to the state of New York and say 600 versus 1200, which is, I think, what New York's at. Imperial which is the worst county by far in California. And I don't mean you as a county. I mean in terms of COVID cases. I got nothing against you, Imperial. The worst COVID cases county by far in California is only half as bad as New York. So New York, what this means is California is not relatively that bad. Yes, it's now a hot spot, which makes it pretty severely hit, but it's got nothing like what New York has. But here again, we're starting to see what may be this fraying of the California rope, as a few counties are starting to spin off the main rope. Los Angeles. Oh, I did not expect that. But yes, Los Angeles often does get it. Obviously, a population center, not super dense, but it tends to be one of the worst when things get bad. Though I think we've had waves where LA kind of missed them. But yeah, Los Angeles is then surely our biggest problem. We've seen this in past waves. If Los Angeles goes to hell, the rest of there's nothing you can do about the rest of the state. And the state as a whole goes to hell because Los Angeles is all the people anyway. And so these can all be chipper, but if Los Angeles is doing poorly, then the total numbers of the states are going to be bad. So yeah, Los Angeles is pulling itself away from the mainstream. It has Omicron. It's written all over this graph. As does San Francisco. Whoa, we didn't expect that either. I keep hearing about the big cities, but until just recent days, I kind of felt that California was avoiding that. But no, it is not. San Francisco has Omicron in a big way. It hasn't quite reached that mad accelerating pace that we've seen in New York City or in Chicago, but this is not good. San Francisco is getting the full Omicron treatment. San Diego, I knew that was going to happen. I knew that was coming. So there's something happening here, which I guess shouldn't be surprising, which is because of the explosive, ridiculous effectiveness of Omicron, infectiousness of Omicron. Any population center just gets flattened. If you have a neighbor that you can see, they're going to give you Omicron. And so Montana might be okay because you can't see your neighbors, but every big city, it looks like, if these three are falling now, I think we're going to see every big city do the same. Ventura, Tuolumne, I know how to pronounce that now. You proud of me? Tuolumne, San Bernardino. So yeah, there's a lot of this is sort of this San Francisco area, Marin, Kings, Santa Barbara. So Southern California is, except then there's also San Francisco. Let's look at the Bay Area, where I tend to spend my time, because the Bay Area also has been spared a lot recently. Let's see, I'm not going to put San Joaquin in there. I will put San Francisco because that's certainly the Bay Area, but mostly these have been looking pretty good. Monterey, sure. There's another one. Which one I forgot? Oh, Santa Clara for sure. There's, I think, yet another one, Alameda. If we take all the Bay Area counties, they've been doing all right. They've been hovering around 100 for a good long time. Now, again, I don't like 100. I like 10, but 100... No, wait a minute. This is these are the cases per million. I don't know why it's showing me a negative number there. I thought I'd fallen into the growth graph by mistake. Yeah, these are cases per million. So I'm just going to fade away that 100, negative 100. We can see it better anyway. So it's been at or really below 100. Like everyone, all these counties were below 100 at the end of November, a month ago. And then there was Thanksgiving, which is probably why they bumped up a little bit. And now there is Omicron. Interestingly, Monterey has been perfectly immune to Omicron so far. And I guess this kind of matches what we see with Montana and Wyoming and some other places, which is to say the rope it's like it has some momentum. A lot of it takes a while for certain of the threads to break loose. But here in the Bay Area, San Francisco has broken loose from the rope. This is absolutely a fraying of our Bay Area rope, and the rest are already starting to follow. You can see some pretty severe upticks in Santa Cruz, Santa Clara, Alameda, San Mateo. I don't know why Monterey isn't there yet, but it'll get there. I know I work for a company that has a presence in Monterey County as well as Santa Cruz County, and there's lots of other people going back and forth between those counties, and there's no way Monterey survives this at a steady 160 for the next month. It's gonna get hit. So we're seeing the beginnings as particular regions catch Omicron as a group, shoot off to the stratosphere, and then whatever commerce they have between neighboring regions cause those to catch it. They shoot off. It's much like how the disease spreads on an individual basis. It spreads through proximity. It spreads through commerce between regions. And so we're seeing the beginning of unquestionably a rise in the Bay Area, what's probably going to be a stark, flaming rise in the Bay Area, and then California as well. I think we've got some very sharp rises across the country ahead of us. Maybe we'll get lucky and Omicron will peak at 1,000 and drop away, but even so, I think many of these threads will go to 1,000 before they peak and drop away, and I wouldn't be super surprised to see them go higher. We just don't know how high Omicron can go. It's a new strain. It's got a whole new set of infectiousness numbers to it, R factors and so on, and all the old rules are gone. We never used to see 1,000, but now maybe we'll see 100,000. Who knows? Something to watch. So I guess I'm back in business, watching these numbers and letting you know what I see. But for now, what I see is we're at the beginning of a very sharp rise in cases, and then the optimist viewpoint. That may be okay. That may be all right, because that sharp rise is because Omicron, arguably a milder strain, is pushing out the most dangerous strains. Yes, infecting everyone, but infecting everyone with something that is plausibly not typically harmful. Now, if I'm wrong about that, which I well could be, and if Omicron is as dangerous as Alpha, then we're in for some very great suffering in the coming month. That I don't even want to. I'm not even going to lay the table for what that's going to look like. But triple the infection rate with everything else the same. Not good. At least we still have the drugs, but yeah, there will be a lot of trouble. So I sure hope that the early data about Omicron, suggesting that it's has a much lower hospitalization and death rate, is true. But we'll start to know in a week. We'll really know in a month. I think I'll probably be coming back to report in on that. That's it. My name's Greg Farrar. Thanks for watching.